Good morning, everyone, and welcome to the third annual Global Climate Action Symposium. My name is Kim Cobb, professor in the School of Earth and Atmospheric Sciences and director of Georgia Tech's Global Change Program. Together with our partners, Georgia Tech Center for Serve, Learn, Sustain, and the Atlanta Global Studies Center, as well as Atlanta-based consulates of Germany, France, Netherlands, Switzerland, Belgium, and the UK, we are thrilled to welcome you to this fully virtual event showcasing some of the many people, programs, and organizations who are rising to the climate challenge. This morning, on the second day of the symposium, we will feature climate and health, and tomorrow we'll dive into the UN Ocean Decade. Within each theme, you can expect to hear perspectives and insights from a diverse array of experts with ample time for interaction with you, our valued audience members. Today's masterclass will take place midday, focused on the Anthropocene with spotlight videos and student lightning talks scattered throughout. Stay until tomorrow at noon to learn the winners of our student art contest. Needless to say, the logistics of this symposium are daunting, and none of this would have been possible without the amazing work of the Global Change Program staff, most notably Selena Perrin and Daniela Estrada. I also want to thank the Ray C. Anderson Foundation for its sustained and generous support of climate-related research and programming, such as the Ray C. Anderson Center for Sustainable Business, the Georgia Climate Project, Drawdown Georgia, and the Global Change Program. And now I'll turn it over to Selena Perrin-Langler, Communications Director of the Global Change Program. Thanks, Selena.
Hello, everyone. My name is Cisse at the Georgia Tech Global Change Program. I'm excited to be here with you today for day 2 of our third annual Global Climate Action Symposium. Today's discussions explore the intersection of climate and health, and that is a broad interdisciplinary topic very relevant to us all. So in order to better frame this topic, I'd like to introduce Dr. Gueladio Cisse. Dr. Gueladio Cisse is head of Ecosystems Health Sciences Unit in the Department of Epidemiology and Public Health of the Swiss Tropical and Public Health Institute, where he is also a professor. Before joining Swiss TPH, he worked for more than 20 years based in his originated West Africa region. For more than 25 years, he has been engaged in eco-epidemiology research, exploring links between water quality, environmental pollution, climate change, and environment-sensitive diseases. He is a member of IPCC Working Group 2 on Impacts, Adaptation, and Vulnerability for the IPCC 6th Assessment Report. Welcome, Dr. Cisse.
Thank you very much, Daniela, for this kind introduction. Good afternoon from Basel and good morning to you in Atlanta. It's my pleasure to deliver the opening remarks for this symposium day topic, which is on climate change and health. And I would like to thank the organizers for giving me this privilege. I would like to invite you now to go with me through only 3 slides. So please turn to the next slide. This is a very interesting PowerPoint figure issued by the Centers for Disease Control and Prevention of USA, issued some years ago, but I found it very much illustrative of what we are discussing today. At the heart of this figure, you have all the climate manifestations and hazards and how they occur, and through exposure pathways and then through also vulnerabilities that they found at places or in some groups. It's now evidenced in the literature that several health outcomes are showing sensitivity to climate change. And it goes from infectious diseases to non-communicable disease, chronic disease, mental health, injuries, and so on. I will not detail that, but I just wanted to put this for all of us before starting the day. And we also ensure that there is a growing scientific literature on the matter going on, highlighting the increase of this impact and that we could go for even worse in the future. Next slide. This is the second slide. And this slide now I'm taking you to the most recent released scientific figures about what happened and what will happen if we don't do a few things. So this is a figure taken from the IPCC Working Group 1 which looks at the physical science basis of climate change. And it has released its report on 9th of August, last month, one could say. And as you may know, the AR6 will be completed in 2022 with the reports, when the reports from Working Group 2 and Working Group 3 will be also completed. But from this Working Group 1 report, I'm just selecting this figure to convey one of the main messages from that report. And here, science has spoken, and science message is clear here. If you take some scenarios combining shared socio-economic pathways with some representative concentration pathways, if you look at the 5 scenarios that are plotted here, it's only 2 of them that are plotted here that could lead us staying below 2 degrees Celsius by 2100. And then let's go for the third slide. That's about what to do about this from climate change, from health perspective. I want you to look at the left up corner of this slide, where I took again a very impressive, nice illustrative figure from one report for World Meteorological Organization. It's showing how the layers of our planet could look like depending on which temperature above the pre-industrial period would be our planet would look like. If you look at the left side, if we succeed keeping 1.5 degrees Celsius, we still have a planet with a pattern of blue or green as representative of life on Earth. But the more we move for missing that target, if you go to 2 degrees Celsius, this is how our planet would look like. It's a symbol showing that we are no more in the blue or green area of life. And then when more we move to 3 degrees, then things start to be hot. And there are very strong statements that I'm collecting here. You have heard them in voices of higher personalities than mine. If we see this, that climate change will then affect all systems, and that every system that is impacted by climate change will at the end, if you look at water systems, if you look at mountains, or look at any other system, agricultural system, food systems, and look at every specific places also, be it mountains, be it in coastal areas, urban context, and so on, it is at the end, it will end up by affecting health and well-being of people living in those contexts or areas. So that's why people say climate change will, in fact, affect health, because health is the closest human face of the human being. And that's why WHO directors, general directors, and many other voices said again that climate change will be the most important public health challenge of the 21st century. So if we are to reach the Paris Agreement's goals, some are saying that the 2020s decade, one starting now, must become a decade of effective transformational action. And some are even saying, if we go to quantitative estimation, that emission must fall by 45% for a chance to limit global average temperature rise to 1.5 degrees Celsius. And if you know that the warmer planet will lead to more problems that will end up in the beds in our hospitals, in the care system costs, in the treatment costs. So health sector, health people should be also standing with others. But we need to see an effective climate global action taking place everywhere. We should and can all do something about it. So today, if you look at the agenda, you will listen to inspiring keynotes, panel discussions, and presentations that will be for sure inspiring people for action, inspiring all of us for action, so that we have a global action for a climate resilient development in the future. Next slide. I wish you then a successful symposium day focusing on climate change and health. And I thank you again very much. Have a nice day. Thank you so much.
So much, Dr. Cisse, and thank you to our incredible audience for joining us today in this global discussion. Yesterday, we welcomed an audience spanning over 30 different countries in 16 US states. So wherever you're calling in from today, I want to welcome you to this discussion. Feel free to say hi and share where you're joining us in the chat. Today's events begin with a keynote from Laura Jung, after which we'll join panelists in a discussion on what a changing climate means for health and which communities may be disproportionately vulnerable. After a round of brief lightning talks, we'll conclude today's events with our second class in our MasterClass series, Humans and Environment, a CoEvolution Story, which investigates climate and health from the lens of anthropology and archaeology. You can find the link to the full event agenda in the chat. During coffee breaks, we'll show selected student art pieces from our Climate and Art contest. Winners will be announced on September 29th. Now, I'm thrilled to introduce today's keynote speaker, Laura Jung. We'll reserve time at the end of the keynote to ask audience questions, so make sure to use the Q&A and chat features to interact with other attendees and ask your questions. Laura Jung is a medical doctor, a global health consultant, and an infectious disease researcher from Germany. She is also a board member of the German Alliance on Climate Change and Health and has specifically worked on planetary health education and solutions in the European and African context with national and international partner organizations like the World Health Organization and the Global Climate and Health Alliance. In the past year, she has also looked at the interdependencies between health, natural and social environments, and how this intersects with COVID-19. Thanks for joining us today, Laura.
Thank you. Hello, everyone. I'm actually just coming from another consultation with African lecturers on environmental health, and it might be a very different context, but on the other hand, it's really not, and I hope that's getting also clear in my presentation that how everything is connected. I'm gonna try to share my presentation. Please let me know if you can see it. Okay, is that good?
Oh, it's great.
I don't hear anything, so I assume yes. So yeah, first of all, welcome everyone, and thank you for joining in for this very important topic. And I'm sure that each of the speakers at this event here is going to tell you that this is the most important topic, but climate and health really is. So I brought you this slide where you can see me 2 weeks ago on a climate protest, and some of you might maybe ask, what's going on with those doctors? Don't they have enough to do anyways? We're in the middle of a pandemic. Why are they now also going out on the streets? And I want to really answer this, or I want to answer actually two questions today. And one is, why do health professionals care about the climate? And why should you too? And then the second question is, what is the health sector actually doing against climate change? And the first question, yes, why do we care? The answer is really simple, because it matters. Climate change is a health problem. The Lancet, which is kind of one of the most important health scientific journals, even said already in 2018 that climate change is the greatest global health threat we are facing in the 21st century. So there is an actual problem. But for a long time, it hasn't been perceived as that. And the reason is quite simple. So if you type in, and I really invite you to do this as an experiment, if you type in climate change in just your whatever you use as a search engine online, then usually something like this comes up. So I see polar bears. I see a bit of like Arctic landscape. I actually see like 4 polar bears, right? Like as the first imaging coming up. And I have to say, personally, I live in a mid-European city, and I can't really relate to what I'm seeing here. It looks like it's not really affecting me. And neither do I live in like the Arctic, nor do I live like somewhere in what looks a bit like a desert. So this here, what I find when I Google climate change, it looks like it is not affecting me. And that's exactly the mistake that we have been making for a long time, because that's just not how it is. If I could choose how like the images would look like when I Google climate change, I think it would look a bit more like this. Because it really is how it looks like. So, and here is actually, I can now relate to that. I see doctors, I see children, I see people in cities, I see people at their workplaces, and I see people being affected and their health being affected by climate change. And that is the face of climate impacts. It's not the polar bears, it's not the deserts, it's not the oceans, it's all of that as well. But what has really effects is this. It's us and it's our health. And I also choose this image that already was introduced to you by the previous speaker, but I'm gonna walk it through with you in a bit more detail because it is really interesting. So it's from the CDC, and if you start from the middle, you see kind of the environmental changes that are happening. And then in the second row, you see what that means in terms of health and environmental changes. And if you walk through there from like air pollution in green on the upper half to change of vectors for infectious diseases, increasing allergens, that's actually a really big problem. A lot of people, like millions of people, are affected by that. Water quality impacts, the same, like we see more cholera cases worldwide. Water and food supply impacts. I mean, this now starts sounding serious, but malnutrition is really related to climate change, to changes in crop yields that we see that are affected by the climate around us. Environmental degradation that then leads to forced migration and civil conflicts. Also, that is something that you don't always allocate to climate change in the first place, but it very often is at least related. Extreme heat, I think that is something that really most people of us can feel. We had really a few very hot summers in a row, and especially, I mean, the Western US and Canada were really affected this year. This is extreme heat is really something that we see, especially in cities, because they build those like heat islands, and people are very vulnerable to this. And then severe weather events. This is also something that I think most of you can relate to. We all have experienced at least storms. Like now in Germany this year, we had extreme floodings. A lot of countries know wildfires and how those have increased over the past years. The US is very affected. Australia has been very affected. Southern Europe also this year has been very severely affected. And this again goes with loss of housing for people, with injuries, fatalities, and obviously also mental health impacts. I could like really throw tons of numbers and examples at you for like every single point on this image, but I think really what you should take from that is everyone is affected, everyone will be affected, and every part of your body can be affected by climate change. And this includes physical and mental health. It's really not restricted to a single organ or a single group of people, but everyone will be affected. Everyone's health is at stake when it comes to climate change. And I think that's an important message that we have to take with us at this point. But it doesn't stop there. All of you know that, especially in the past 1.5 years, we had another very severe health issue, and that was the coronavirus pandemic. And there it's important to think about how the coronavirus and climate change are also interlinked with each other. And there we have to now actually take a step back, because obviously climate change didn't directly cause a coronavirus, but environmental change might have actually contributed. And what I mean here is the loss of biodiversity mainly, and the loss of natural habitats for wildlife. What we know is that more than 60% of the so-called emerging new diseases, emerging infectious diseases that we see worldwide are from like a zoonotic origin. So they are coming from animals to humans. And that was most likely also the case for the coronavirus that we are fighting still right now. So why are they increased over the last decades? That's very simple, because we're losing biodiversity, we're losing natural habitats, and human and wildlife are actually in closer contact than they have ever been before, just because we really reduce the spaces where wildlife is still able to thrive, and we are getting closer and closer to that. And that increases the risk for us. So it's not only climate, but also biodiversity and natural habitats that have an influence on our health. But then it's not only what's created or like what contributed to the development of the coronavirus pandemic, but also the impacts. And there is something that we call compound climate risks. It's actually a very interesting dynamic if you look at it. So the impacts of the coronavirus are affecting specific groups more. And if you look closer, it's often the same groups that are also more affected by climate impacts. So that is older people, obviously, we all know that. That's now also pregnant women. That's also, for example, people who already have a lung disease. But that's also people that have like a lower, or from like a lower socioeconomic background, or especially for the US, we also know that Black people are more affected by both the pandemic and the climate, and it often multiplies. And I just give like some like specific examples and where we really run into problems. So for example, in the summer of 2020, it was extremely hot and we have seen wildfires. And what we usually do is we provide shelters for people to like cool down, or when they have to be evacuated from where they live, we provide them with shelters. But how do you provide shelters where people are like kind of crowded because it's just a short-term solution in the middle of a pandemic? It kind of becomes impossible. And that were situations where, as like health professionals, we were really struggling to make the right decisions. And at the same time, also health professionals have been directly affected. Very simple, if you look at the PPE, for example, that healthcare professionals are working, and I have been working on an infectious disease work last summer, I can tell you it's really no fun wearing a full body PPE in a 30-degree heat. It really impacts how much people can work, how exhausting their work is, and also probably the care that they can provide. So we really see that coronavirus and climate change together is something that we can very hardly deal with, but they are connected from where they come from. So do we have to find ways to fight them both together? And how can we do that? And what we use right now as a model in climate and health spaces is the so-called planetary health approach. It's going a bit over just climate change, and it includes exactly those factors that I have been mentioning before. So biodiversity, for example, environmental degradation, land use, pollution of our seas and our lands, and many more of different determinants that are based on the planetary, or like so-called planetary boundary model. But it also includes a lot more. It's actually about thinking more holistic and really at the intersection of disciplines. So planetary health means we're looking at the human health in relation to the health of the planet and in relation to the health of the environment surrounding it. And that includes the natural environment, but also the social environment. So planetary health really is a field at the intersection of everything else. And it might seem like a new concept. It has been used in health sciences for maybe the last decade, slowly, but it's not really a new concept when you think about it. So it's a lot based on indigenous understanding of health, and there is a lot of indigenous principles and indigenous solutions as well that are really in harmony with this planetary health. So it's a new, not so new concept maybe that we can use to understand health better in the future. And that also helps us to find climate solutions, because we don't always want to just focus on the impacts, but also on what we can improve. So thinking about what is a way forward from where we are now, in a planetary health perspective, it means that we need to align the global COVID-19 recovery with our response to climate change. And I use this little image here that's coming from the Lancet Countdown on Health and Climate Change, which is one of the best sources really if you want to see the health impacts of climate change been documented. Just check out their website. They have a really nice interactive page as well, where you can see different figures and graphics and just go through the numbers. It's actually fun playing with. So if you're interested in the concrete health impacts, that's where you should go. But they also very clearly say no one is immune from the health impacts of climate change. And we can't focus on a COVID recovery first. And it has been discussed a lot actually, right? Is COVID-19 maybe good for the climate? Because for some time we were all really locked into our homes. No one was going out. We saw that air pollution sometimes is going back down when no one is taking the car. Well, that's not a surprise, but that's also not a solution. We can't all just stay at home forever for the planet to recover. We have to find a way to recover together and recover in a way that makes it for us possible to live, but at the same time keeps the planet alive. And the good thing, if you're a health professional, is that you can actually offer something. We have a very good argument for climate action, and that's where the fun starts. That's the so-called health co-benefits. So actually, climate action makes sense from a health perspective, because a lot of the stuff that's good for the climate and good for the planet is also good for your health. And I think I brought two other images from the Lancet Countdown, just also because I think they are really nicely made. But one example, for example, is urban green space. Urban green space is one of really the best measures that we have to reduce heat in cities. That bit can break down the heat island, helping cool down. At the same time, it provides places where we can go, where we can be active, where we can relax. It's really good for mental health. It's really good for children's development. Green spaces and parks really is on the plus side for humans and the planet. On the other hand, diets is another very good example. If we eat more healthy, and we know that especially in the global north, we have a lot of issues with a healthy diet right now. It's a lot too much meat, a lot too much very processed food. If we would eat more healthy, less meat, that wouldn't just be great for the planet. That would, first of all, be really great for us. And another very simple example, for example, is active transport, cycling and walking in our daily lives. That gives us a lot. A lot of us have jobs where we are sitting most of the day, we're not moving much. But if we can use active transport, that first of all reduces emissions by reducing, for example, cars, fossil fuel use in the city. It at the same time reduces noise. It at the same time reduces air pollution, and it's good for us. So really, climate action in the most cases is good for you. There is no reason to not get active. And I actually only showed you half of the quote from the Lancet before. So I now want to show you the full quote, which is, climate change is the greatest global health threat facing the world in the 21st century. Okay, that we know. But it also is the greatest opportunity to redefine the social and environmental determinants of health. So yes, we have a problem, but we can also work on the solution, and it's going to be good for us. And that is exactly why health professionals care about the climate. But what are they actually doing? What does that mean, health professionals care about the climate? And on the photo, what you see is a group of doctors and nurses, and I think public health professionals, in a big protest in front of the German parliament. As some of you might know, we just had elections 2 days ago. So this was a big pre-election protest to set climate and health on the agenda of the politicians, but also of the voters. Because we know that health really depends on the context. And that's another figure from the Lancet Countdown on Health and Climate Change, which places the health impacts of climate change in the middle of an economic and political context. And that is really how we have to see it. Like, health is not on itself. It's always in the middle of society, and that's also where we have to start tackling it. So what are the key steps from a health perspective? First of all, health professionals need even more, but they already did, organize and build networks. So in Germany, we have the German Alliance on Climate Change and Health. There is a Global Climate and Health Alliance, and there is nearly in every country right now a Health and Climate Change Alliance or organization that is working on those issues. Just because climate change is so present in the health space, then the second really important step is inform the public. I think that one is kind of obvious, that health professionals are the right people to do that, to talk about health impacts. And it's actually our job to translate very complicated science as you get it from the IPCC or other climate documents, take those informations and translate into something that everyone can understand and that everyone can deal with. And that's exactly why I think the health argument is such a great one, because everyone has access to this. Then advocating for change, especially within political networks. I think this is a really important one, and I'm on the next slide going to present what we did before the German elections, just to highlight a bit what I mean when I say that. But the third point is also really important, and that is transforming the health sector itself. What we know is that the health sector itself contributes about 5% to the national emissions. Differs a bit from country to country, but that's like an average, 5%. So it's not nothing. If we want to be like really honest about what we're doing, we should start there. And that's why there is a lot of initiatives right now that are working on a green health sector and how we can achieve that. There is big organizations like Healthcare Without Harm who have been doing that for a long time. there is some countries really leading the way. I'm mainly looking here at England and the NHS there, that's having a great campaign right now towards green healthcare. But there is still a lot to do, and there still also need to be more solutions to really get towards zero emissions in the health sector. But one often overlooked part is also that the investments that are happening in the health sector. So divesting from climate, from investments that are risking our climate is really important. Divestment usually is something that's not a classical health topic, but we really try to make it one as well. Okay, now coming to the elections and what we did. We actually did a lot because we thought it's really important. If you have an election in 2021 and climate is not one of the top priorities, you're doing something wrong. So we planned out something quite big. We had a position paper that was by our German Health for Future group. It was called Your Climate, Your Health, Your Choice. And it summarized the most important points to make the case for climate and health in Germany. We also really directly talked with hundreds of politicians. We had panel discussions where we invited politicians from different parties, and we really tried to set the topic on the agenda because we thought that's where it belongs. At the same time, obviously, you also have to inform everyone else in the population about the health impact of climate change. And then for that, we had the protests. Obviously, we're always part of the global climate strikes as well, but this time we organized our own protests as well. That in Berlin went right to the government buildings to make a strong statement for the climate. And we also wrote a blog post about that, and everyone is interested. You can find that on the website of the Global Climate and Health Alliance and dive a bit deeper into the topic of the German elections. The elections are over now. The coalition has not been built, so we're not yet exactly sure where it's going towards. I think our hopes were a bit higher for what we got now, but we have to see how we deal with that. And I think that is also something that you really learn when you do this work is it's never finished. It always continues, and there is always more to do and more to improve. And especially in the case of climate, we know that extremely little time is left for us to achieve a lot. But climate is not only a priority in national politics, it's mainly on the international stage that the negotiations are happening. And I think all of you are aware that the next big thing coming is the COP26 in Glasgow, which had already been postponed from the past year. But yeah, what's the role that health really plays in those international negotiations? And there I really have to say it's a rather small one, also it's growing. But traditionally, health wasn't really part of the climate negotiations. There is usually a very small group of health activists that are present and that try to really deliver supporting arguments for everyone else who is there. Because I think that's what we can do the best. The health argument is really strong, and it's really making a case for strong climate action. But this year we're prepared also quite well, and there is a range of call to actions, open letters, and statements that have gone out. Actually, only at the beginning of this month, more than 200 health journals, and I'm really talking high-class health journals from all over the world, called for urgent action on climate. I think that was the first time that more than 200 journals published the same editorial at once, which is a really strong sign that had been made there. And also on like a very practical aspect, the health community delivered, and that is on the NDCs, the National Determined Contributions, which basically are the measure what countries want to contribute or which actions they want to take in the future. And the Global Climate and Health Alliance looked at the mentions of health in those NDCs. So they really went through each every of the really already published NDCs, because there is still some are still coming, but what has been published by now, they looked at those and tried to evaluate how much health is in there, how much health mitigation, how much health impact, but also how much health adaptation is in there, and how concrete are those plans. And what it really shows is that it's mainly the small and heavily impacted countries that mention health. Maybe that's not a surprise, but there is most of the higher income countries or the global north countries that are really seem to be uninterested in health. I think the US kind of made it at least in the middle of the table. The EU, I think, went out with like 0 or 1 point. So it seems like they really don't have the health perspective yet on climate, which is obviously a problem when we talk about how big the impact is of climate change. And I think another really good example is that for like the longest time, when we talked about climate impacts at the international negotiations, there were 2 types of impacts, and one was economic impacts, and the other were like economic losses, and the other one was non-economic losses. And health and people dying is seen as a non-economic loss. As a doctor, I'm really struggling with those terms, and I hope you do too, because I don't want my life seen as just a non-economic loss. And I think we really have to reframe the debate also on an international stage if we want to make climate action about us and about our lives, and that is really what it is about. And with that, I'm already coming to the end of my presentation, and what I really hope that you're taking away from that is the key message that climate change is a health problem, but it is way more than a problem. It is also the way to a better living, because climate action doesn't just mean that we are losing something from the comfort in our lives, but it really means that we can live more healthy. Living in harmony with our environment and with our planet also is a benefit for us. And I think that's really what we should take with us and why we should be active. And all of us, not only health professionals, but really all of us act on climate change because we care about our health and the health of everyone around us. Thank you.
Thank you so much, Laura. We have some time for some audience questions, so please do put those in the chat in the Q&A. Laura, the first question that the audience was really curious about was that you mentioned that climate change threatens human health, but also poses opportunities. So how does the COVID-19 pandemic pose opportunities for changes in our systems, or changes in individual behavior as well?
I think one very big opportunity that, well, I mean, I still struggle like talking about opportunities from COVID, because I think we really have to see how really bad it was for a lot of people globally. But yeah, it gave us the opportunity to experience something, or to like see some things that otherwise we would have not. And if we just focus on that, one definitely is to see how many things really are possible online. I think there is a big opportunity in that, because obviously global travel also contributes to the emissions, and we now learned that maybe we can do a lot more online and saving emissions like that. But it also, for example, for air pollution, it was a really interesting case study, if you want, and that's really now more a researcher talking here. A really big real life example of what happens when we just don't use cars and when we just tune down the industry, and how does that really affect how we live. And we could see that, yes, like air quality in many places is becoming better immediately. And actually that's a good thing. But now we have to find ways where we can have those good levels of air quality in a way that we are still able to move around. And I think that's the challenge that we are facing now.
Thanks. The next question is concerning vector-borne diseases and changes that we might experience or see. So how is climate change affecting the impacts of disease-carrying insects like mosquitoes?
That's a really good question. It's also quite a complex question, and we don't always know yet, because there is many environmental factors that are affecting vector-borne diseases. It's not only the temperature, but it's also the humidity and other factors. So we have models. We are not always 100% sure that it's gonna be like we assume. But what we already see is that it's most likely that mosquitoes that are transmitting diseases like, for example, yellow fever or malaria might be able to come more to the north. Where I live in kind of central Germany, we now had over the past 3 years the first cases of West Nile virus, which I know in the US has been present over the last few decades. But those are really things that we haven't seen here before or for a long time, and they are slowly coming back. And then obviously one really big issue in the field of infectious diseases is tick-borne diseases, Lyme disease. We see that this is becoming a lot more prevalent in northern regions. We are not yet sure if maybe then it just like moves or it just becomes bigger, the area where the ticks are prevalent. So that is something to be seen, but we definitely know the patterns change. And right now it looks like in the end, more people will be affected by diseases that are rather serious.
Thanks, Lara. Our next question is about climate change education. And the question is climate change education commonly built into curricula for healthcare professionals? And do healthcare professionals discuss climate change impacts with their patients?
Yes, thank you. That's a really good question. And it might not come to a surprise that it's not. It's a discussion that we are having for the past at least 5 years quite prominently, but in most countries, really, it's not part of the national curricula. I know it best for Germany, so here we don't have it. We're working on it. We see a lot more volunteer initiatives that try to bring it to the universities, that run electives, for example, and things like that. In Germany, we also run a very big online lecture series that at some universities has been accredited, but it's usually not in the national curricula, so it's not mandatory. And that obviously is a big issue, like when we're talking about a global health crisis, and our future healthcare professionals are not even learning about it. So this is for the med schools, but the situation usually is even worse for everyone who has already been graduating, because we don't get them if we have climate change now in the medical schools. We also need it really in the continuous medical education. There is also still missing. There is usually a very few initiatives that bring it forward, but it's by far not enough. And that is really, really something that we have to work on, and that has to be improved.
Thank you. Our next question is a follow-up question on insect and tick-borne diseases. And that is a question about how do we monitor and assess the spread of these or the change in range of insects?
Which ways are there to monitor? Sorry, is that the question?
How we monitor and assess the changes in spread of these insect-borne diseases.
I mean, there is different ways to do that, and I'm by far not an expert in all of them, but so one is clinically. So, for example, what we see in the region where I live is just we suddenly have diseases that before we just had not, and we diagnose them, and we're like, oh wow, where's that coming from? And then you try to investigate, and you're like, so first, when we have like vector-borne diseases that are not that are not common in the area, we try to find out, did this person travel? It's like they maybe get the person infected somewhere else. And if that's not the case, then you get a bit nervous and you're like, okay, wow, so person didn't travel, so it must be from here. And then if you have like more and more cases, and maybe also other, not only humans, but sometimes also animals get infected, and then at some point you're kind of clear, okay, this disease seems like it's now here. And then, yeah, then you see that the spread has increased. But obviously there is a lot of modeling also happening, and a lot of like parasitology and people that are really looking at the mosquitoes or really looking at the ticks and how they change and how they change in spread and so on. But I'm really not the expert for this. I'm really more on the clinical side.
Absolutely. Our next question is about urban heat islands. So broadly, how do urban heat islands affect human health? How do they affect populations? And are there any impacts on local rainfall and growing seasons? I know that might not necessarily be your area of expertise, but definitely the human health aspect.
Yes. Urban heat islands, I think, is a really interesting topic. So we really see that cities are a couple of degrees hotter than their surrounding regions. And that is due to the fact that obviously there is less green spaces, there is a lot of concrete, and the concrete heats up very easily. It also saves the heat. It's overnight even, it stays hot. And the health issues that we see is really, yes, when the temperature is really high, but mostly when the temperatures don't fall at night. So that's what makes us issues. We also call that sometimes tropical heat nights. Those are like, well, in Germany, I'm actually not sure that it's the same temperature globally, but in Germany, we say if the temperature is not going down to under 25 degrees, and I'm talking Celsius here, so under 25 degrees Celsius at night, then that causes issues, because usually at night is when your cardiovascular system tries to reset, relax, to calm down, but it can't calm down if it's too hot. And then that causes stress. And that might not be a problem if you're 25 and healthy and sporty, but that might be a problem if you're 78 and you already had issues with your cardiovascular system before. And now we know that a lot of older people actually have issues with the cardiovascular system. And we really see that on those hot periods, we have more people in the emergency rooms. We have more people that have to be admitted to the hospital. Often very simply also because of dehydration. That's mainly people that are also in elderly people homes and care homes, or that are just alone at home and they don't react properly to the heat, and then they dehydrate, and then they also have to at least go to the emergency room, sometimes have to be admitted. So then we also run into problems because we reach hospital capacities, but we also see a higher death rate during those times. And yes, not everyone in the city has been affected the same way. That's, I think, very easily to understand. There is areas in the city where there is more green spaces and more space and bigger houses and people have pools. And those people are obviously less affected than people that maybe live in poorer areas where there is more concrete, less trees, where maybe not everyone has air conditioning. I think that's also a big issue. We are now running into the situation where more and more people live in places where they need air conditioning, and they have not needed that until now. So now we have to think about how can we basically stock up all the houses with air conditioning. And then it's also clear who gets their air conditioning first, right? In the this summer, we have seen really fights over air conditioning in Western Canada and the US. So we really, it's not the same for everyone. There is people that are more affected than others, and we have to really tackle those inequalities within our cities to make them livable spaces for all.
Absolutely, and we'll talk more about that at our panel discussion. Definitely a very relevant topic. So you mentioned that having less trees can exacerbate that heat island effect. Are there any other human health implications of having less trees around? Can you talk more about the roles of trees in human health in urban environments?
Yes, I mean, trees are great. I'm really big fan. They are not going to solve all our climate issues. So just planting trees is not going to be the solution. But for cities, really, it's the best way to cool down. I mean, we use other techniques as well, like, for example, a white paint on roofs or even on streets to have like higher reflection, but really nothing works as well as trees. At the same time, trees also obviously good for air quality. They are acting a bit as a filter for air pollution. They are also good for mental health, obviously. So green spaces, really big effect on mental health of people. And then also for, in case of like flooding or extreme rainfall, where we have more trees and more green spaces, that also gives us a certain capacity to deal with those high amounts of water that are coming in a very short amount of time. And for example, what we also have seen in Germany this year, why the floods were so impactful, like one reason was that there is really a lot of concrete, and then what that means is the water can't go anywhere, and it really collects at some places, and then you have a flooding in one particular place, which maybe would not have been the case if there would have been more green spaces and just more spaces for the water to go into the ground instead of staying on top of our asphalt roads.
Great. One thing you mentioned is trees can improve air quality, and air quality being a human health concern, especially now. One question we got from an audience member is asking about the changes in ozone and how that might affect human health, and how air quality changes could affect human health moving forward.
Mm-hmm. Yes, so air quality is a really big topic, and we're very lucky that just in the last week, the World Health Organization released their updated air quality guidelines. They are a bit, for really most pollutants, a bit stricter than the ones we had used before. And what we see is that nearly no place in the world basically keeps within those recommended levels. So nearly everywhere in the world, we are exceeding recommended levels, and we have too much air pollution. But ozone is also a bit different because of it has an effect on how the ultraviolet rays can get through. So that is not so much a risk than for the the lungs, but more a risk for the skin, and that is more risk for example, skin cancer development. But I think the ozone layers have also been one topic that has been on the agenda for a bit longer, whereas those other air pollutants that are mainly affecting the respiratory system, it's much harder to control and have been not that much on the agenda. So I hope they are getting on there very soon, because actually the new data of the World Health Organization is also a bit scary, and it really shows us how we all are affected by air pollution and over basically our whole lifetime. So that also adds up. Is, I think, the biggest risk of air pollution, not the one very bad day, but really the years and years of a bit bad days that accumulate.
Yeah. So our next audience question is asking how we can take a more holistic approach to healthcare, encompassing things like sustainable food, organic food. We spoke a little bit about this at yesterday's symposium, and maybe you can broaden that and explain how healthcare can take that more holistic, broader approach.
Yes, thank you. That's definitely something that we need, and that's a bit included in this green healthcare concept. But yeah, I'm happy to dig a bit deeper into that. So personally, for me, it's really not understandable. For example, the food that we provide to patients in hospitals, they are usually not even in accordance with the national dietary guidelines. They are usually very meat heavy, they are non-organic, so basically what my patients get as food in the hospital, I would not recommend them to eat at home. I would recommend them a different diet. So I don't understand why that is what we provide them with in the hospital. That is definitely something that has to change and that needs to be tackled. And I think sustainable diets are now also a bit more in focus in sustainable food systems. And I hope that we really can use the attention that the topic has now to make it an issue within the healthcare system as well, and that we can work towards providing better food for the patients. But yeah, in general, I think a more like holistic approach to healthcare really helps, and that's also one of the things that I think they can get better, because a lot of people always frame the like climate debate as really a debate where it's about like losing something. But in many aspects we can improve, and like healthcare is one aspect where we really can improve, and where we can provide better care when we make it more sustainable and include climate considerations as well.
Laura, thank you so much. If you could leave our audience with 1 to 2 key takeaways, what would they be?
I should have probably prepared for that. No, I think that the key takeaway really for me is that so climate change is about humans in the first place. It's really about us. If you take climate action, you're not saving the planet, you're saving yourself. And then the second key takeaway from my side is that this really also means climate action makes our lives better and healthier. And if you take climate action, you're doing something for yourself as well.
Laura, thank you so much for your time today, and thanks to our audience for all of their amazing questions. This has been a great discussion. We'll take a brief coffee break now, after which we'll have a panel discussion. During the break, we'll showcase top student art submissions. Thanks for being with us today, and we'll see you all back for our panel discussion at 10:30 Eastern Standard Time. Welcome back to the Global Climate Action Symposium. Today we have an incredible panel of experts who will delve deeper into topics of climate, health, and equity. We'll reserve that last 15 minutes of the panel discussion for audience questions, so make sure to keep using that chat and Q&A feature. Now, it's my pleasure to introduce today's moderator, Ciaretta Profas. Ms. Ciaretta Profas is currently a policy advisor at the Ministry of Health, Environment and Nature in Curaçao. Ms. Profas holds a bachelor's and master's degree in environmental policy and management from the Saxion University in Utrecht University. She joined the Ministry of Health in Curaçao in 2010, working on local and sub-regional project management with emphasis on sustainable development goals, waste and wastewater management, radiation safety, and climate change, while fostering a broad network of stakeholders from the governmental agencies, civil society organizations, the business community, and knowledgeable institutions. Thanks for joining us today, Ms. Profas.
Thank you very much, Selena. Thank you for the kind introduction. I would like to welcome and greet all the audience that is following us, joining us for this discussion, and also I want to welcome our distinguished panelists that will be joining the panel discussion of this morning of today, which is about climate and health. And I'm joining actually from the island of Curaçao, which is in the Dutch Caribbean. And firstly, I want to introduce the group of distinguished panelists and experts of today. Firstly, I want to introduce Dr. Christina Fuller, is an assistant professor at the Georgia State University and an environmental health scientist investigating questions concerning environmental exposures and impacts. Her research aligns with three related areas: the fate and transport of particles and gases in environment, the disproportionate burden of environmental exposures and outcomes on marginalized populations, and the devising and testing of novel solutions to near-road particulate matter exposures. Dr. Fuller is dedicated to community engagement in the research and the democratization of information that promotes environmental equity. I want to welcome Dr. Fuller to this panel discussion of today. Welcome. Following Dr. Fuller, I want to introduce Dr. Rebecca Watts-Hall. It's a service learning and partnership specialist in Georgia Tech Center for Serve, Learn, Sustain. She is interested in the relationships between student activism and sustainability leadership on college campuses and broader social movement. Previously, she served as executive director of Mothers and Others for Clean Air, a nonprofit partnership advocating clean air policies. Mrs. Dr. Watts-Hall has worked as a science and environmental education curriculum consultant and in environmental project management in East Africa with the U.S. Peace Corps and in Washington, D.C. with the World Wildlife Fund and other nonprofit organizations. Welcome, Dr. Watts-Hall. And finally, I would like to welcome also Dr. Noah Scovronick, is an assistant professor in the Rollins School of Public Health of Emory University. Dr. Scovronick research focuses on understanding the links between human health, climate change, and climate policy. Dr. Scovronick is academic interest includes environmental health and air pollution, and also conducts epidemiological studies of the effects of climate and weather, particularly as it relates to outdoor temperatures on human health. So I want to welcome all of the panelists of the panel discussion of today. The panel will discuss mostly and firstly the link between the global and local health implications of changing climate with Atlanta-based experts. Scientific evidence clearly demonstrates that global warming poses a serious threat to climate patterns and also environment. Climate change affects the social and environmental determinants of health, such as clean air, safe drinking water, sufficient food, and also secure shelter. So in this sense, climate change is from this perspective now a recognized health emergency. So in this context, our first question is especially most important issues involves around general awareness of the population to health implications of climate change. So the question is about why is the topic of climate and health so important right now, and what are the most critical challenges from each perspective, from the panelists' points of view concerning global health system. Towards, if you look towards the future changes also in climate. We will start first with Dr. Fuller, and then following Dr. Watts-Hall, and lastly with Dr. Scovronick. I will give the floor to Dr. Fuller.
Okay, so thank you so much for inviting me to be on this panel with my esteemed colleagues, and also listening to the presentations earlier was very insightful, and I think that we're going to come up with a lot of the same themes, in this discussion. Hopefully we can talk about it, a little bit more. So, in terms of climate change, I think it is very relevant right now because we have really started to feel the effect and see the effects. If you think about the wildfires that have been happening in the United States out west and in other countries like Australia, and see how that is linked to air pollution, which is a predictor of health. If you look at hurricanes that have been increasing in number and also intensity, and how that has been linked to increased flooding and disasters as well, in places where we don't typically see some of those types of flooding. Even in the northeast of the United States, we've had hurricanes go all the way up there. So they're showing up in different locations, and people are being impacted now that they wouldn't have thought before. So some of the challenges with that is, my area looks at environmental justice and also climate justice. So climate justice is a movement to address how the impacts of climate change are not equitably distributed. People who are low income, countries that are low income, different populations that are marginalized across the globe are being impacted a whole lot more due to systemic issues that have been placed upon them by society. And making sure that we are addressing the overall challenge of climate change and also the inequities within that is really very important. And we have to address both at the same time and as soon as possible, because we're really already behind, but it's never too late to really address the issues that we've been facing.
Thank you, and good morning, everyone. I'm really thrilled to be participating in this panel today, so thanks for the opportunity. I want to piggyback on something Christina just said, and also something that Laura noted in the keynote address. So in terms of why now, I think we have a real opportunity because of not just the increasing awareness that we are all vulnerable to climate change that Dr. Fuller just pointed to, but also the vulnerability that we're very aware of because of the pandemic. So one of the points that Laura made in her keynote is that it matters very much how we frame these challenges and these issues. And she shared a bunch of pictures of polar bears and said, that kind of framing of climate change has kind of undermined our ability to advance the significant public health implications of climate change. And she suggests framing it as planetary health. So right now, we have a particularly strong opportunity to take advantage of public awareness of the fact that we are all vulnerable as a result of the pandemic to really advance this planetary health frame for climate change. And second, I'll just say, I think the same is true in terms of the justice issue. So what the pandemic has also made clear is that while we're all vulnerable, we're not equally vulnerable. And some individuals and some communities are much more vulnerable, whether it's a result of historic inequity or differences in workplace conditions or differences in access to health care. We're not equally vulnerable to the pandemic, and we're not equally vulnerable to climate change. So the fact that the climate action movement has already shifted toward a climate justice frame, that I think should be resonating with quite a lot of people who are more aware right now than they used to be of disparities in health vulnerability.
All right. Hi, everybody. Sorry to interrupt. Nice to be here. Thank you for the invitation. Just to piggyback on what the other speakers have already said, I think, to answer the question of why climate and health is so important and so important now, one very simple way of looking at it is if you essentially look up the top dozen or so risk factors for death and disability globally, what you'll notice very quickly is that a number of them are actually will be directly affected by climate or are already directly affected by climate. So, several of those are related to diets and nutrition. We know that climate change will affect food production and food consumption. We also know climate change will affect exposure to air pollution that's already been mentioned, as well as hot and cold temperatures. And these things are both responsible for millions of deaths every year. Now, in addition to that, we also know that many of the adaptation and mitigation policies will affect many of these same risk factors for death and disability. They'll affect what we eat, what we breathe, where we live, how we travel, and so on. So I think there's really a unique opportunity here to simultaneously reduce the impacts of climate change itself, while also improving public health on a number of fronts while we do it. And that's what's really exciting. And I think the second thing I would have mentioned also is that we can do that in a way that sort of reduces health inequalities and health disparities, but the other speakers have already mentioned that. So I'll leave it at that. But it's sort of, although it's daunting, it's also very exciting in those sorts of ways as we think about what to do about climate and health in general.
Exactly. All the panelists for highlighting, especially the challenge. I heard the keywords, especially inequalities, addressing inequalities, and also then that we are vulnerable, but that we are not equally vulnerable towards climate change effects. But that is a very great stepping stone to the next question about if we look at the disruptiveness, especially the emergence of the current pandemic, COVID-19, also expose the limitation of human control and also human capacity for contingency planning and preparedness, and also prevailing politics and policy. If we look at the IPCC report that was published this year, it was also recommended within the report that a more action-oriented research agenda is needed. Which knowledge gaps need to be addressed in this sense, and which ones need to be prioritized? I can start first with Dr. Scovronick, and then following with Dr. Fuller, and lastly with Dr. Watts-Hall.
Thank you. Yeah, I think when I think about this question of what needs to be prioritized, three sort of sets of issues jump out at me. The first one is that we really need to do a better job in the public health sphere of understanding adaptation programs. We spent a lot of time, I think, in public health over the last 10 to 20 years really focusing on mitigation. But now that there's some serious amount of climate change already baked into the system, we need to maybe shift our focus, or at least complement that focus on mitigation with a focus on adaptation, in order to really understand which adaptation strategies work and which ones are also cost effective. And that's going to be something that needs to be done sort of in general, but also we know that adaptation to a certain extent is inherently local. So that'll need to be done, differently depending on where you are in the world and what those climate risks you can expect, what the climate risks you will expect in that location. The second thing that jumps out at me is that we actually don't know a lot about the sorts of climate and health impacts that we might expect in a number of low and middle income countries. And particularly, I would say, in parts of sub-Saharan Africa and South Asia. And that's a problem because it's difficult to design adaptation strategies and other strategies to prevent those impacts without that sort of knowledge. And those places are also places we expect would probably be very vulnerable to certain types of impacts. And they're places that have a lot of people, and they'll have more people in the coming decades. So it's particularly important that we dedicate more of our research effort in those regions. And then the last thing I'll mention, which maybe will be a bit provocative, is that I think we're actually coming to a point where we also need to start understanding the public health impacts of potential, what we call geoengineering solutions. Now, I'm not an advocate for geoengineering necessarily, but I think as those sorts of solutions become more tempting, we need to be prepared for that in case, if and when it becomes, if and when we see it in the mainstream policy debate. And we really need to know what the risks and benefits are of those different options, because we don't want to be caught off guard just because it was taboo for us to actually think hard about that and to dedicate, our research time on it. So I'll leave it at those three things. There are several others, and I look forward to hearing what the other speakers have to say on this issue. Thanks.
Thank you.
Sure, that's great. I'm sure some questions may come from the geoengineering. I have some questions. So, I mean, from my end, I think in terms of gaps, it's very important, and it was just mentioned by Dr. Scovronick about having more information from specifically lower middle income countries. So I work in the area of air pollution. So having data at the local and national level is really important, because therefore with that data, you're able to really see what the issue is and how it can be addressed in different countries and in different communities. And if you don't know that, then you're not going to be able to design the correct solutions. So that's, number one. Number two is working with communities. I'm very much an advocate of that, to figure out what types of design solutions or adaptations are really going to work in their communities. Because although climate change is a global issue, what we need to do is have global policies, but also local policies. And we're able to make a lot of change to the emissions that are fueling climate change by doing local level activities and local level changes, especially if we're able to then get other communities to pick up on those. So working with communities so they're sustainable and equitable solutions is really important. And around air quality, that really is about local air quality monitoring and making it as affordable as possible, making it accessible to community members, but also robust enough that we can do real scientific analyses at the same time.
And my response would overlap somewhat with Dr. Fuller's. So I think that the greatest gap is advancing transdisciplinary research and solutions. And I think I have a bias in that area because I'm a social scientist in a space that is oftentimes dominated by natural scientists and physical scientists. And also because, like Dr. Fuller, my work focuses on engagement and collaboration between community-based organizations and universities. And transdisciplinary approaches both bring together a wide variety of disciplines within academia, but also reach outside academia and value traditional forms of knowledge, indigenous knowledge, the wisdom that comes from place-based activism over decades in a particular community. It brings all of that together, and I think that's crucial if we are really to develop and implement solutions that are going to be, as Dr. Fuller said, both equitable and sustainable. And interestingly, I think this is a space where the activists are really ahead of those of us within academia, because the climate justice movement really has become truly transdisciplinary, one could say. I had the opportunity to attend Power Shift Convergence in April, which is a global gathering of thousands of youth climate justice activists. And they absolutely understand that climate justice is racial justice, is food sovereignty, is LGBTQ plus rights, is indigenous rights, is labor rights. I could go on and on. All of those spaces were represented at this climate justice gathering. So I think our youth leaders absolutely understand the interconnections. They're building power by bringing together people who understand that all of the inequalities globally are interrelated and have some of the same deep roots in historic inequality. And there are many initiatives locally and regionally that I think are becoming more transdisciplinary. And Dr. Fuller and I are about to kick off an initiative to try to advance this in the Atlanta region tomorrow. But I think it's also true that really diverse and representative transdisciplinary collaboration is still not the norm in climate science or in higher education. So we need to figure out how to really advance that at a much faster pace.
Thank you for your contribution. Question actually sparks another question in my mind, especially concerning low and middle income countries, because you mentioned that they are most vulnerable, especially with regard to climate change impact. But if we look at these kind of communities, how they can prepare for the excess burden from climate change related issues. And we can start with Dr. Watts-Hall concerning the question. Yes.
Thanks. Well, my work does focus in the U.S., but I have some experience working at the community level in East Africa, and I think no matter what kind of community that we're talking about, it's important for us to address historic inequities because they've had such significant impacts on resources, particularly economically. So I think we really need to take seriously calls for reparations, whether we want to call it that or call it something else, addressing some of the current challenges that communities face that are a direct result of racially discriminatory practices and inappropriate colonial or neo-colonial practices in other countries. Secondly, I think we need to, as Dr. Fuller alluded to earlier, the global north has made so many mistakes in the way in which we go about collaborating with communities in the global south on this issue or all kinds of sustainable development issues. So we need to be very careful that engagement truly is centering the priorities and the perspectives of folks in the communities that we want to see benefit from those. And I think asset-based approaches are very helpful to that rather than needs-based approaches to collaboration at the community level. And the last thing I would say, and I guess it gets back to the historical inequities issues, is directing resources to community-based organizations, rather than, having all the resources coming from the global north.
Dr. Scovronick, maybe you add into this question?
Sure. Yeah, so I definitely don't have the experience with these sorts of issues that Dr. Watts Hall does, but I think when I sort of try to conceptualize ways of addressing these issues moving forward, I tend to think about essentially two approaches. One approach is more sort of pursuing what we might think of as more traditional social and economic development objectives. So these are things like education or infrastructure or improvement in health services and that sort of thing. And these are things that are very much important even in a world without climate change, and it makes them sort of doubly important in our world where there is climate change. Those sorts of interventions are good regardless, and they will definitely help build resilience towards climate change itself. And then the second approach is really to try to focus on the sorts of policies that are really aimed at climate impacts, aimed at reducing climate impacts. And those sorts of things, as Dr. Watts Hull mentioned, are really going to be very locally oriented, will need to be designed in consultation with the communities themselves. And I think we can do a better job of really trying to understand which of those sorts of policies and interventions work, which ones are good value for money, and which ones, how can we potentially, even though they are going to be very local, how can we potentially transfer those lessons from one community to another in a way that doesn't force everybody to have to, reinvent the wheel, so to speak, each time, because there will be, we will be able to learn a lot in one place that can be adapted to another. So I think that's sort of how I like to think about those sorts of issues, and I think we can make a lot of progress if we take those things seriously moving forward. And I'll leave it there.
Sir, you want to add? Maybe
just a little bit. I just want to piggyback on what Dr. Watts Hull was talking about in terms of power dynamics and the shifting that's required, and the imbalance in resources, because honestly, this crisis has been created by higher income countries doing things wrong for a long time, and then lower middle income countries have to deal with all the burdens, and then lots of controls around money and resources globally that really holds those countries back from being able to do the things that they need to do. And, this is based on a lot of experience that I have working in Ghana and working in Jamaica, of, having people there who, are qualified just as much as the researchers and communities here, but just not having those resources there. So there's just definitely needs to be a shift in terms of resources for the lower middle income countries to be able to work on those issues that will function for them in terms of their adaptation.
Thank you very much. I remember earlier on the question concerning the knowledge gaps. You all mentioned, for instance, that we need to shift from mitigation measures to more adaptation, to geoengineering solutions, also to focus more on the low income and middle income. Concerning those knowledge gaps that already have been addressed, which research priorities are needed to address the challenges, but in the next 10 years? And will these actions that we take today be enough to minimize the direct impact of climate change on human health? Who wants to start first? Anybody can take the floor if they feel compelled to.
Well, I don't know if I know the answer, but in terms of will it be enough, I think I'm not sure that framing is particularly helpful, because what we know is we know that there's going to be sort of a continuum of impacts, right? There is an amount of climate impacts that are going to happen, but even for a given amount of climate change, we do have some control over whether that climate change causes really devastating impacts across the board, or whether we try to work to adapt and to minimize those impacts. And that's really about smart policy. And if we do implement strong policy and smart policy, we do have an opportunity to really try to hopefully end up on the lower end of that continuum. In terms of what to do about it, I'll just try to be brief, but I think from a health perspective, from a health impact perspective, you can think about the impacts coming from three different sort of realms. One is we have these very extreme events, floods, hurricanes, wildfires and so on, and we have to be ready for those. And that's one sort of set of policies from a health intervention perspective. Then we have the sort of very climate sensitive impacts that we can identify as climate impacts, but may occur more around, I don't want to say the margins, but these will be things like range expansions of certain vectors and more red tide. So they might not be as extreme, but they'll be occurring, and we need to be ready for those in new locations or in the same locations with increased frequency or intensity. And then we have these sort of more subtle and more sinister impacts that may not even show up as climate impacts. We may not be able to identify them as climate impacts, where we'll see maybe more cardiovascular and respiratory diseases that are just occurring from sort of these marginally increased exposures to things like air pollution and things like heat and so on. And those things, well, all of them really are really going to interact with the social determinants of health. So if we're not real careful and we're not smart about doing something about climate change and what we do about it, not only are we going to see bigger health impacts, but we're going to see widening disparities or new disparities that we haven't seen before. So I think that's really what we need to be focusing on in the next 10 years or so. And we can make a difference for sure, even though we're all a little exasperated that we haven't done more so far.
So, I agree with all that was just said. It's not too late, but the more we wait, it's going to be a reduced rate of return on anything that we do. So it's really important to get started or continue, because it's not that we haven't started, but to continue with even more determination we know a lot about the global impacts, but how that breaks down in the local sense, and what kind of information we need to answer the questions. And I'm just really, over time, just about thinking and acting locally so that things can be put into place and we can see how they work, and then hopefully do that in the idea of scaling things up. So instead of being so top down, to be more bottom up. And around environmental justice, which is the realm in which I do my research, it's a very grassroots, it's a bottom up approach. So I think that will really assist us as, the whole planet as a people, to really work more from that approach, of more of a bottom up approach, and putting into place changes, strategies locally, and then with the idea of scaling them up to being bigger.
Yeah, I think that makes a lot of sense. And I would add just something I reflected on in terms of learning from COVID. I think, unfortunately, in the US, one of the things we've learned from the pandemic is that we have a lot of work to do in the area of federal, state, local coordination in our public health system. So I think if we are to respond to what is already here and what is worse to come with climate change, we really need to address that and improve that coordination. And to your point, Dr. Fuller, about the critical importance of the community level, think another thing we saw during the pandemic, and we continue to see, is that where the government has really failed, communities often step up. And as just, one tiny example, a woman in my neighborhood just took it upon herself to try and address low vaccination rates among Black residents in my neighborhood. And she figured out how to make vaccinations available at places and times that made more sense through the Black churches in the neighborhood. And she also figured out how to use community networks to address disinformation. And she had a significant impact on our, hyper-local vaccination rates. So, we can't rely on tremendous volunteers like that to do all this work. We also have to address where the government is not functioning in the way that it should be. But we absolutely need both and in the area of climate action.
Exactly. Thank you. So finally, to finalize our panel discussion, I want to focus on the way forward with regards to accelerating change in the area of climate and health. You already mentioned that better coordination, partnerships, solutions, especially at community level, should be integrated. In your opinion, and also from your own perspective, research perspective, how and what do we need to do exactly to move forward in order to accelerate change in the area of climate and health? You already mentioned a lot of very interesting, insightful points, but what would be the key change aspect if we look at acceleration in this area? We can start with Dr. Fuller to provide a contribution for this question.
Yeah, so I actually want to start answering that question by continuing with the last question, which I find, we're talking about public health. And one of the reasons that I'm speaking, for the United States here, but I think it's going to be similar in different places across the world. But there's disparities in the severity and also the instances and infections for COVID-19 in the United States and abroad, and especially for low-income people and for people of color. And that's based on, how people are living and then what they do to make a living. So it's where they live, what they're eating, what their stresses are like, and then what exposures they may have to different chemicals or to different environments that are reducing their overall quality of their health. And so really putting prevention again at the forefront. In the United States, we don't do a very good job about that. We treat disease once it shows up, but not as good of a job about prevention. Because if you have these chronic conditions, if you have diabetes or you already have asthma, you are more likely to have an adverse, a more stronger, severe response to COVID, with those chronic conditions. So within the healthcare system of making sure that we focus more on prevention instead of just the treatment of disease is important. And those are all socially driven of who is disadvantaged in the community based on their ethnicity, their race, their income, their job, all of those things. And so I think in terms of, moving into the future, it's important to really retain those positive aspects and draw upon those things that are making some communities resilient. I think also in public health, we tend to just think about those aspects of why people are sick, but don't look at why there are some communities that are resilient. So figure out what those things are so that we can magnify those for communities and for the larger community as a whole. And I think that's really important in terms of moving things forward and addressing these challenges.
Thank you very much. Or very interesting aspect that you raised. I want to hear from both panelists, Dr. Scovronick, also if they agree with the same aspects or they want to add more to the aspects list.
Yeah, I mean, I actually don't feel like I have much to add because I think the other two speakers have already done a great job by identifying some of the most important issues here, meaning things like more multidisciplinary approaches, more community-based approaches. I completely agree about a focus on prevention rather than treatment. Absolutely. So I don't think I necessarily want to add much to this question beyond just to say that the one thing that, if you were going to ask me what keeps me up at night when thinking about this, one of the issues I would worry about, and this I think speaks directly to why those other approaches are so important, is that I think so many people in the climate area, from researchers to activists, are so desperate for action. What we want to make sure we don't do is design actions that are ineffective or potentially either counterproductive. So we've been waiting so long to act. We feel like there's a window of opportunity to act, but we still need to make sure that what we do acts to address the problems that we actually will face, that it doesn't worsen disparities, that it does, absorb some of those climate impacts and so on. So that's just the only thing I wanted to add to this question, is that we need to act and we need to do that in an intelligent way. And the way we can do that is through these approaches that Dr. Watts-Hull and Dr. Fuller identified, meaning multidisciplinary, community-based, preventive, and so on and so forth. So I'll stop there and just thank them for their insights.
You're muted.
Just saying, if Dr. Watts-Hull wants to add to the question, or is it quite comprehensive already what we discussed about moving forward? So
I think my colleagues' responses are definitely quite comprehensive. I would add maybe just one quick point, because it was highlighted in the IPCC report, is that we definitely need to do a better job of connecting levels of effort. So we've talked a lot on this panel about community-based efforts, and local needs to be connected to regional, needs to be connected to state level, needs to be connected to global. And also that needs to be true of governmental action and non-governmental action. And Lynn Ostrom, the Nobel laureate in economics, called this polycentric governance, that we need to figure out how to do a better job of linking all of the locally or regionally based activity at larger scales, so that we can really amplify all the good work that's already underway.
okay. Thank you very much for.
Oh, sorry. One last thing. I just agree with that, what Dr. Watts-Hull just said. And, as a researcher, we tend to think that, our data is going to speak for itself. And then everyone will be able to see, and then changes will happen. And that's just not how it works. And I think this is why a grassroots approach is very important, in addition to, top down, because we got to have some major policies as well. But for people to really identify and know how to get people in their communities, in their, regions, in their countries excited, how to change things, and also to know how it affects them. Because, if people don't feel that pull for it being personal, somehow it's hard to make people change to do something that is difficult. And we have to do really difficult things to really solve this problem. So I really think that it's important to understand that we need to know how to tell a story with the data, personal stories, so that people really know how they have a stake in this game, which isn't really a game, it's all of our lives and the whole planet. And we cannot forget that if we want there to be effective change.
For the contribution of each of panelists today, Dr. Scovronick, Dr. Fuller, and Dr. Watts-Hall. I remember during the keynote, one specific thing was mentioned is health is the human face of climate change. So that's why it's an emergency, and we need to get together, work with it. All partners get aligned so we can advance, especially on the topic of climate and health. Now we're moving to the second session. It's about the Q&A. We have a few questions from the audience. There were many other questions, but because we have limited time, we can address a few. So the first question is about what specific resources are available or needed to make this fight more equitable. I remember during the panel discussion, we had more equitable about equity, actually. So this is very much related to what was discussed during the panel discussion. I remember Dr. Watts-Hall mentioned about equity, also Dr. Fuller. Perhaps I can open the floor to each of you to elaborate more on this question. What specific resources are available or needed? Let's start with Dr. Watts-Hall.
Sure. Well, one example that is currently underway that can help in that way, I think, is called the Justice 40 Accelerator. And Partnership for Southern Equity here in Atlanta is involved in that initiative. It's using federal funds that have been made available to build capacity in community-based organizations. So not just formally established nonprofit organizations, but informal frontline community action around environmental justice that is taking place in all kinds of communities with very limited resources. So I love the model. I love that model of capacity building, and they're pairing more experienced organizations with less experienced organizations, and really focusing on capacity building at the grassroots level. So I think that kind of approach has a lot of promise. The other thing I would say, which is maybe less about equity so much and more about engaging a broader range of folks. I think we need, in terms of climate action, I think we need to do a much better job, and this particularly comes from my work with college students, of making clear what social change looks like and what it means to be an advocate or an activist. I think many people think that being an activist is holding a sign at the front of a large demonstration. And the reality is that, that's an important part of social movements, but it's one tiny piece, actually. It takes sustained, well-organized, highly strategic action, oftentimes over decades, to result in social transformation. And people with all kinds of gifts and skills contribute to those campaigns and those movements. And scholars do as well. Teachers do, artists do, storytellers do. And we need to do a better job of telling the story that there are many ways to contribute and to be part of the climate justice movement in order to get more people engaged, I think.
you want to add also what resources are available from your field of research, perhaps, or in the community?
I mean, for me, that's not quite my area in terms of those specific tools. However, in terms of involving communities in research, I work on community-based participatory research projects. So that's working directly with local communities to design research questions and carry out the research and then disseminate the knowledge that comes from that. And it has a specific framework so that we can have research that's more relevant with regards to the questions and also the data that goes into it. But in terms of policy, the one that I'm probably most familiar with is Health in All Policies, which is also a framework that's being utilized a lot in cities and municipalities across the world, so that there's coordination between all the different parts that you need to run a city or a state and think about health as being an endpoint. So I know that's a framework that's well utilized in lots of different places.
Thank you. We'll move to the next question, which is about what can be done to improve high school curriculums in regards to topics such as climate, environmental science, and health. Can I give the floor to Dr. Scovronick to contribute? What can be done to improve high school curriculum?
Well, that's not something I know pretty much anything about, to be perfectly honest. But what I will say is that, as cliche as maybe it sounds, I do think that you can very much make the issues of climate change exciting and interesting to a high schooler. You know, on the one hand, we think a lot about the future when we're talking about climate change. So that future is their future, which is critical. So that, you know, there's a lot of entry points from that perspective. The other point that I'll highlight is that one of the things I personally enjoy about working in the climate field is you sort of get to imagine the society that you might want to live in, because if we're really serious about climate change, it's going to entail very profound changes in society across the board. If we're really going to seriously reduce our emissions and also seriously design adaptation programs, the structures of society will change. And if we do that, that means we have an opportunity to do that in a way that's exciting, that's green, that's sustainable, and so on and so forth, that's equitable. And so, you know, those are the sorts of issues I would imagine a high school student could get excited about because of, you know, the imagination involved and because it's their future that we're talking about. So I'll leave it at that. But from the practical standpoint, I don't think I have enough experience teaching in high schools to answer.
So in my experience, I've been involved with some programs that have been, tied in, not into the curriculum, but kind of as an extracurricular activity. But in terms of curriculum, they, already learned some measure about climate change. So I think just to add to that would be, some volunteer time of working with an organization, because when I've had my students and also the high school students, when we come and just do some kind of activity, if it's going to be in a community garden, if it's going to be even doing media for a climate justice group or something, but just giving some kind of tangible volunteer experience really helps it to come alive for them. And I think that's something that may be easier to implement versus working in a lot more content. I know it's so difficult with what schools already have to do, but at least including some kind of volunteer component, I think would be very advantageous, make it relevant for them.
Yeah, that makes a lot of sense. I would definitely agree that incorporating service learning at the high school level, which is really growing in higher education, it would really help with that. And I think they are highly constrained. At the same time, I think high schools really need to grapple with the same question that we are in higher education, that complex problems like climate change are not discipline specific. So, to really do that well, you've got to figure out how to get the English teacher talking with the social studies teacher and talking with the environmental science teacher, if it's going to incorporate not just an understanding of the science, but empower students with a way to respond to what they understand about this.
I'm experiencing some technical difficulties with my internet connection. Can you hear me? Sorry. Oh, yes. So for the last question, okay, that's good. For the last question, it's very interesting question because you are researchers, of course, and very distinguished experts. So one of the questions are related to, as a researcher, how to make impact through your work as a policy researcher, I guess, in climate and health to advance, especially towards policy changes. So I don't know. Can we then start with Dr. Watts-Hall?
Sure, and my role is not as a researcher. I'm an academic professional, and of course nobody knows what that means. But I support curricular integration and service learning and community engaged research at Georgia Tech around sustainability. Yeah, the primary way that I do that is through the education work that we do with our undergraduate students and the ways in which we collaborate with community-based organizations, which our goal in that service learning is not just to deepen and extend student learning, it's also to contribute to the ability of those community-based organizations to meet their objectives in a very concrete way. So indirectly, we're advancing policy through the engagement that we have with community-based organizations. With our students, we really take seriously this piece of sustainability education around empowering students to be change agents and helping them, whatever their discipline, to figure out how they can use their disciplinary knowledge to create change, whether it's within a future corporation that they're working for or with an NGO following their graduation or in the community where they live.
So I have, before I was an academic, I was an advocate and an activist. So I've always brought that along with me, into my research life as well. So I do that by working with community groups, again, in community engaged research, and also on, interdisciplinary teams that include elected officials, that include city officials as well, so that the knowledge that we find from research doesn't just stop with the publication of a paper, but it goes on to get to other people that are going to be making the rules that are going to govern local and state and even national, policies. So it takes working in an interdisciplinary team to do that. So that's kind of my contribution, is making sure that it doesn't just stop with a publication of a paper, that it goes on to community members that want to have that information for their advocacy to answer those questions, and also gets to policymakers.
You, doctors.
Yeah, I don't have much to add, but I would reiterate what Dr. Fuller is saying, is that I think as researchers, we sometimes, I mean, probably Dr. Fuller and Dr. Watts Hull are better at this than I am, but we're not necessarily trained in the communication aspect. And so working with communication experts at the ends of projects can be really beneficial. That's certainly been my experience, just to reach a broader audience, to package the messages and the narrative in a digestible and clear way, and also to take advantage of opportunities in the public sphere for when, you know, the issues that you work on are ready to be accepted in the public discourse. Because we know with climate change, we have an ongoing crisis, but we also have things that happen now and then where attention gets focused on a particular issue. So if you're ready to talk about that, you can probably make a bigger impact. And working with experts in that area is really, from my experience, has been a great way to try to do that, to make your work more impactful and to reach a broader audience.
Thank you. So this was the last question of the Q&A. Due to limited time, we have to wrap up. I want to thank all the audience from around the world, different states, for their contribution. I want to thank also the contribution from our panelists today, Dr. Christina Fuller, Dr. Rebecca Watts-Hall, and Dr. Noah Scovronick. Now I think I will give the floor to Selena to wrap up completely. And it was an honor for me to moderate. Thank you.
Thank you all so much for the amazing discussion. And thanks to each of our panelists and our moderator. Thank you to all of our audience members for the amazing questions. And please keep those going in the chat and Q&A. Now we'll hear from students and organizations via short 3-minute lightning talks, after which we'll take a brief break before reconvening for this afternoon's MasterClass, Humanity and Environment, a CoEvolution Story.
Our first lightning talk showcases Dope Peddlers, an Atlanta area group building an inclusive biking community that supports more biking, less driving, and a healthier planet and community.
The Dope Peddlers are a group of cyclists here in Atlanta, Georgia, like-minded individuals who are looking to support one another on and off the bike. One thing that we say is, if you want to go fast, go alone. If you want to go far, then go with a group. The whole goal of Dope Peddlers is to expand community. We believe that supporting one another, that we can make some huge impacts on promoting everyone together as a people. We say that whether you're rich, poor, black, white, gay, straight, Protestant, Catholic, Muslim, all of those things go out the window when you're on two wheels. They say bikes build bonds. We do 3 rides a week. A beautiful day like today is gonna bring out about 30 to 40 people. Sometimes we've had rides as big as 1,000 people. This is Jay Reed. I'm a part of Dope Peddlers, and that's why climate is on my mind.
Thanks for that inspiring message. You can follow Dope Peddlers on their social media accounts with their handle @DopePeddlers. We'll share the link in the event chat. Next, we'll hear from UrbanHeatATL. UrbanHeatATL is working with community members and students using data collected by community scientists to map urban heat islands to better understand extreme heat in Atlanta, especially in relation to historic racism and the legacy of redlining.
Extreme heat is the leading cause of weather-related deaths in the United States. Urban heat islands in particular disproportionately affect vulnerable communities, and heat extremes are particularly deadly in densely populated areas and urban centers such as Atlanta. Research has shown that in many other cities, maximum urban heating often occurs in locations that reflect the compounded impacts of historic racism.
Hey, I'm Gavin Baker. I'm one of the community scientists measuring information and temperature around Atlanta.
And what we're trying to do is get a much more granular view of these temperatures in the places where people live, where they work, where they play. We want to be thinking about things like bus stops, city parks, sports playing fields, etc.
We use these pocket lab sensors to track temperature as we walk.
This reads the temperature and you watch the temperature on the app on your phone. I usually just go for maybe 5 to 10 minutes. It's still going up as we speak. On the weather app, it was 90 degrees. It was like over 95 just from where I was walking.
We can have a much more refined understanding of the exposure, the vulnerabilities, where the problems occur, so that we can really hone in on some of these acute risks, and then of course work with the city and community partners to do what we can to provide these evidence-based recommendations going forward.
Amazing work at the intersection of climate, health, and equity from the UrbanHeatATL team. You can learn more about UrbanHeatATL, including how to get involved, online at www.urbanheatatl.org and on Instagram and Twitter. Our next talk comes from Zara Shivji, a senior Georgia Tech student studying chemical engineering with a minor in economics. Zara will be speaking on air quality and her work monitoring it at Georgia Tech.
Hello, my name is Zara Shivji, and I'm a senior at Georgia Tech studying chemical engineering. For the past 1.5 years, I've worked under the guidance of Dr. Sally Yang studying particulate matter and air quality. Particulate matter, or PM, is composed of microscopic liquid and solid particles suspended in the air. It is typically separated into 3 size brackets: PM1, all particles with a diameter less than 1 micron, PM2.5, all particles with a diameter less than 2.5 microns, and PM10, all particles with a diameter less than 10 microns. Particulate matter can be directly emitted into the atmosphere from combustion, but it is also produced during atmospheric reactions involving pollutants like nitrogen, oxides, and volatile organic compounds. Common sources of PM are cooking, transportation, industry, forest fires, and biogenic sources. Particulate matter is responsible for much of the haze seen around the world. It also plays an important role in climate change, as the particles can absorb or scatter light as well as act as seeds for clouds. Exposure to elevated levels of particulate matter is known to cause adverse health effects, specifically for the lungs and heart, resulting in millions of deaths per year globally. For several decades, the U.S. EPA has monitored and regulated outdoor PM2.5 and PM10 levels across the country. However, these monitoring instruments can be spaced hundreds of miles apart and are very expensive. This largely prohibits the public from assessing the quality of the air they are exposed to, especially since air quality can vary significantly over short distances. In recent years, low-cost sensors around $100 and mid-cost sensors in the thousands of dollars have entered the commercial market. These sensors are attractive because of their affordability and ease of use, allowing them to be installed more densely. They report data for particulate matter concentrations of all 3 sizes in environmental conditions like temperature and relative humidity in real time, which can be directly downloaded from the web, as shown in this video. One low-cost commercial sensor, Purple Air, has become very widely used, with tens of thousands installed across the world. Therefore, it is important to ensure that the limitations of these sensors are fully understood by users so that they can make informed decisions about protecting themselves from poor air quality. To To understand the limitations of purple air and other low-cost and mid-cost sensors, their performance must be compared to the performance of research-grade sensors. For the past year, I've been collecting outdoor particulate matter data on the roof of the Ford Environmental Science and Technology Building on campus, using 2 low-cost purple air sensors, 2 mid-cost Quant-AQ sensors, and 2 research-grade instruments. My analysis has shown that in general, the low-cost purple air and mid-cost Quant-AQ sensors match the particulate matter concentrations reported by the research-grade instruments. However, relative humidity levels appear to impact the particulate matter concentrations measured by the low-cost and mid-cost sensors. Thank you for the opportunity to present. I'm excited to continue this research, which has direct results for human and environmental health across the globe.
Our final talk is from the West Atlanta Watershed Alliance, an all-volunteer organization in Atlanta. WAWA has been successful in preserving over 400 acres of green space from development in southwest Atlanta and raised over $2 million to do so. WAWA is also the steward of a nearby 135-acre Cascade Springs Nature Preserve and the 200-acre Lionel Hampton Beecher Park, all in southwest Atlanta.
WAWA is a community-based organization that works on the west side of Atlanta in the Proctor, Utoy, and Sandy Creek watersheds. We got our start because our community perceived that there were discriminatory wastewater treatment practices in southwest Atlanta in the Utoy Creek watershed. And after a community struggled to challenge the city, a project in which they were planning to place a mini wastewater treatment plant essentially in a community park called John A. White Park. The community mobilized and gathered its forces and challenged the city's plan and ultimately was successful in implementing a citizens plan. There was a follow-up issue that the community also helped to shoot down, and that was going to be the development of an 8-mile sewage tunnel from the R.M. Clayton wastewater treatment facility in northwest Atlanta to the Utoy Creek Water Reclamation Center in southwest Atlanta. So on the heels of those 2 successes, community members in southwest Atlanta in the Utoy Creek watershed, along with residents in the Proctor and Sandy Creek watersheds, decided that there should be an organization that not only fought against these projects that were perceived to be negative for the community, but that we also needed to lay out a positive vision for what we want to see West Atlanta become.
Thank you to all the students and organizations that shared their work with us today. We'll take a short 15-minute break before this afternoon's MasterClass, which will begin at 12 o'clock noon, Eastern Daylight Time. Today's MasterClass investigates evolution of humans and the environment and the Anthropocene with Dr. Celine Bon, a lecturer at the Natural History Museum of Paris. As we go on our short break, please enjoy selected student artwork from our climate art contest. I look forward to seeing you soon.
Welcome back. Today we've heard from experts in infectious disease, global health, equity, and policy. This afternoon's masterclass brings an additional perspective to the table, that of anthropology and archaeology. I'm thrilled to introduce Dr. Celine Bon. Dr. Celine Bon is a lecturer in the Natural History Museum of Paris, France, and a paleogeneticist. After a PhD dedicated to the study of extinct species such as the cave bear, she performed comparative genomic analysis during her postdoctoral research. Since 2014, she is developing a laboratory for the study of ancient DNA in the Musée de l'Homme in Paris. Her research interests include interactions between cultural and social evolution and human and microbial genetic diversity during protohistory. She focused on the role led by migrations in Central Asia as well as the Neolithic Revolution in France. Welcome, Dr. Bon.
Hello, I'm very pleased to be among you. So now I'm trying to share my screen. And here we are. And here we are. Is that okay?
That looks great.
Okay, great. So, hello everybody, I'm Celine Bon. I am an associate professor of the National Museum of Natural History in Paris, and I'm specialized in paleogenetics and human genetics. So I'm very pleased and honored to be among you today to talk about the human species, its history, and especially the interaction that developed for million years between human cultures, human environments, and human biology. So if we go back in time together for this journey, we will see that all the human prehistory began in Africa. So of course, you know that our nearest parents are chimpanzees and gorillas, and that we all belong to a family, the primate family, that had a very long story in Africa. The primates are African species. And the first witnesses of human evolution that we know of are Toumai and other compers, other friends. Toumai has been found in Chad, an African country, at the end of the 90s, and it dates back to 7 million years. Some paleoanthropologists suggest that maybe Toumai may be on the chimpanzee lineage or not on the human lineage, but whatever, it seems really at the split time between the human and the chimpanzee lineages. Other representatives around the same period, a little bit more recent, are found, such as Aurorin or Ardipithecus, and that all these ones we are sure they are on the human side, and they were all found in Eastern Africa. A few million years later, we can find other representatives of the human lineage, such as Australopithecus. There is several species, several groups of Australopithecus, and I'm sure you know of Lucy. And all these Australopithecus were found in Eastern Africa or Southern Africa. Let's go back a little bit more recently in time, and the emergence of the Homo genus. The Homo genus began from an Australopithecus group, but then it differs and began to accumulate some derived features specific of humans. This Homo genus is found also in Africa, Eastern, Southern Africa, and the first representative of our species, Homo sapiens, is also found in Africa. So this one has been found in Jebel Irhoud in Morocco. He has some of the derived features specific for human Homo sapiens, modern human species, but other representative of the human features, a little bit more recent, more around 200,000 years old, are found on the other side of Africa in Ethiopia. So as you can see here, all the first representative for each step in the human evolution are found in Africa. But we can also study the origin of human in Africa using our genomes and the genetic data we can find in our DNA. And there's been several studies that have been performed. For this, here I present the result of the Simons Project, a project that has been led by an American scientist, David Ray, in Harvard. And here they decided to study the genetic diversity of around 300 individuals scattered all around the world and belonging to 132 different populations. And we know in population genetics that in the cradle of any species, it's a place where there is the highest genetic diversity. There is a lot of reason for that. I won't go into the mathematical details, but the idea is quite simple. In the cradle of the species, it's where the population was the biggest, so the more mutations and the more variants, and so the more genetic diversity. And the occupancy of the species in this area was the longest, so there was more generations, more babies, and so more mutations. So that's why, briefly, there is the highest genetic diversity in the cradle of a species. And if you look here in the autosomal heterozygosity, which is a way to measure the genetic diversity, for all these different populations, human population, you see that the highest genetic diversity is here for the orange dots, for the African populations, and all the other population, non-African populations, have the lowest genetic diversity. So this is an evidence, an argument also for the origin of humanity in Africa, of Homo sapiens in Africa. But we could also look at the genetic diversity not of humans, but of our parasites, our pathogens. And here it's an example for Helicobacter pylori. Helicobacter pylori is a bacteria we have in our stomachs. And for some people, it can cause some cancers, stomachal cancers. And if you look here at the genetic diversity here, the white arrow, the highest genetic diversity is found near to East Africa, and the farther you are from East Africa, the lowest genetic diversity is. So even for our parasites, the cradle of their species, of the species of our parasites, is also in Africa. And other parasites, such as the lice, for example, come from African species. So, for example, the head lice was given by chimpanzees, whereas the pubic lice was given by gorilla. So we had interaction with our near living cousin, and somewhere in the past, they gave us some lices. And the same is true also for the herpes simplex virus that we share with other African primates, and even more surprisingly, the tapeworm that we are plagued for, that we can find in our bellies, come from hyena and lions. And the paleoanthropologists suggest that we were infected by this tapeworm when we scavenge the meat of deceased animals alongside hyena and lions long before the fire was invented. So the meat was raw and the tapeworms can survive. Another example, another evidence for the origin of human to Africa is the fact that in our genomes, we are adapted to African environment. And one example is the UV exposure. You know that all around the Earth, there is different level of UV exposure, and in tropical regions, the UV is very dense, whereas in other more temperate regions, the UV exposure is more gentle. And the UV is quite a good and a bad thing. It's a bad thing because it can give us sunburn, and sometimes this sunburn can derive in skin cancer, but that's not a problem for having babies. What's a problem for having babies is that the UV can degrade the folates. The folates, they are vitamins that are very useful for the development of the babies during the pregnancy. And during the pregnancy, when the mother didn't have enough folates, that lead to neural tube defects. So now it's not really a problem. The baby the doctors can cure this problem. But you can imagine that in the deep past, during prehistory, a baby with this kind of defects died at birth. So the UV can have a huge impact on the fertility of humans. But the UVs are also necessary to humans because it helps to biosynthesize the vitamin D, and we need vitamin D to have calcium in our bones. And if we don't have enough vitamin D in our diet or synthesized by our body, it can lead to rickets. And someone with rickets has also trouble to reproduce, so the fertility is done. So you see there is this kind of balance, and we need enough UV, but not too much UVs. And if you look at other primates, for example, at the chimpanzee, this chimpanzee has a light skin color because the skin is covered by hairs, and the hairs protect the skin from UV. So it does not need a high amount of melanin to protect for the UV. On the other hand, a high amount of melanin can prevent the biosynthesis of vitamin D. But sometime in the past, 2 or 3 million years ago, our ancestors began to lose their hairs, their body hairs. And so you can imagine that the ancient humans with genetic variant that help us to have a slightly darker skin, have a lower degradation of folates, and so they had less developmental problems, and so they had a higher fertility. So generation after generation, the people with the genetic variants for darker skin in our African ancestors, became more and more frequent until it was fixed, until all the human population had these genetic variants. So it's exactly how the natural selection functions. And so we have this natural selection for darker skin color in the ancient humans. And we can see it now when you compare one gene, the MC1R gene, which is involved in the skin color in humans and in all the mammals, in fact, we can see 10 changes between all the humans and all the chimpanzees. And even when we have a light skin color, such as me, I have these changes that in the deep past helped my ancestors to protect against the UVs in Africa. But now I am in Paris, some of you are in Atlanta and in all other regions all around the world, so humans left Africa. And in fact, humans left Africa not only once, but several times. When you look, the most ancient humans out of Africa are very ancient. They date back to around 2 million years ago. And they were found in Georgia, in the Caucasus, in the Dmanisi cave. In this cave, there were 5 individuals, but all belong to the same species, the Homo erectus species. And after that, we can find Homo erectus fossils in other regions in the world, especially in East Asia, and the Philippines and Java. And Homo erectus was there for 1 million years and for a very long time in this area. But more recently, we find other examples of humans out of Africa, and they're represented by Homo heidelbergensis, which is most Western Eurasian European species. And Homo heidelbergensis gave birth to 2 different groups. One is Homo neanderthalensis, which is very well known, the first fossil humans that has been discovered. And another one has been discovered in the Altai mountain, and it's the Denisova group. We can find also other human species, such as this hobbit human, the Homo floresiensis, which has been discovered only 20 years ago. And this human has very strange features because it looks like very archaic. Some people even suggest it's not a human. It's another species. It's maybe a Homo habilis or even more ancient species. And of course, we have had some modern humans, some Homo sapiens that left Africa, and the most ancient one were found 100,000 years ago in the Near East. And after that, we find humans all over the world, and since a few dozen years, even in Antarctica. So as you can see here, there is at least 4 out of Africa events, one for the ancestors of Homo floresiensis, one for Homo erectus, one for Homo heidelbergensis and Neanderthal and Denisova, and one for the modern human. And we can study the last out of Africa event, the out of Africa event of modern human, also using genetics. To do that, we can use DNA to reconstruct the size of the population of our ancestors. Just looking in your DNA, you have information about the size of the population your ancestors were in. And here is the size of the population on the left, and you have the time here from the present to the deep past. And if you look at African population, you see that the size of the population was more or less flat in the last 100,000 years. Except for this population, which is not an African population, which is an Eurasian population, in fact, the French here. In this population, around 50,000 years ago, there is a huge decrease in the size of the population, that we call in population genetics a bottleneck. Here, there has been only a few individuals that have left Africa. And this is true for the French, but in fact, on the bottom panel, you can see that it's true for all the non-African human population. It's true for the French in green, for European, so in green, for Asian in red, for New Guinean in blue, for Yakuts in green here, and for Mixe, a Native American population here in yellow. You also see the other bottleneck linked to the peopling of America, something like 15,000 years ago. So all of this population shares the same bottleneck event. And another evidence for this out of Africa event is that human reproduces with the other Eurasian species. Here in purple, in pink, you have the amount of DNA in European, Asian, Melanesian, or Native American population that derive from Neanderthal, this other Eurasian species. And in purple, you have the amount of DNA that derived from the Denisovan species. So we have also in our DNA, all the non-Eurasian population, evidence for admixture with this other Eurasian out of Africa population. So when humans left Africa, they met a lot of different environments. The temperature was very different. You can have very hot regions in some islands, but also snow on very cold region here, for example, in Beringia. You have different UV exposure. In some regions, the UV exposure is similar to the one we find in Africa. In other regions, such as islands, the UV exposure is less important. You have different altitudes, for example, in the Himalaya. And of course, the available diet was very different. You don't eat the same thing when you live in a Mediterranean environment or, I don't know, in a Beringian environment. So humans were not adapted when they left Africa. They were not adapted to this different environment. And the environment for all the animals and for all the living species is not only the temperature, the altitude, and so on, but it's mostly the microorganisms. And when they left Africa, humans met new microorganisms, new pathogens, and especially when they have relationships with the other species, such as Neanderthal and Denisova. Well, we know now that hugging people, you can exchange some pathogens and some viruses and some bacteria. And so there probably were exchange of pathogens between the humans and the Neanderthal or the Denisovans. So what happened there? Well, what happened was adaptation. In this map, I show you some of the genes in which we have evidences of selection for the different environments. So you have, for example, evidences for selection for lighter skin color in Europe and in Asia, and some genes like the TIR gene was involved in both events, whereas for other selection events, for other variants, we have different genes that were selected. Interestingly, these genes, for example, these variants for this gene emerged something like 25,000 years ago in a region around the Anatolia, Caucasus, Levant region. And we can follow how this allele, this variant, genetic variant, diffuses after in the Western Eurasia. There is also example for adaptation to altitude, and in some cases, like here in the Tibetan population, or like here in the Andean population, the same gene was involved. There is also evidence of selection against pathogens. And very recently, a few weeks ago, a publication found that in the Southeast Asia population known in the past an infection by another coronavirus, and have evidence of selection and positive selection against the coronavirus in this area. So our story is not the only one in the human history. You have also evidence here that this population known frequent starvation, and so the individuals that had genetic variants that helped to have a high BMI to be able to stock the calories were had more children and more babies than the other. And so now there is a high number of genetic variants that help to fight starvation. And so on and so on. So against the cold, for example, in the Siberian population, for a high fat diet, for Inuit population, etc., etc. And some of these variants came from our Neanderthal and Denisovan ancestor. For example, the IPACE1 gene that we can find in the Tibetan mountains in the Tibetan population came from admixture from the Denisova that were there a few thousand years ago. So we can think that, okay, human left Africa, human by selection, adapt to the new environment, and so all is the best in the best possible world, and this is the end of the story. Well, no, because something happened, and this something is a Neolithic revolution. It's a dramatic change in the way of living of the human population, and it occurred more or less simultaneously in different parts of the world. The first one is the Fertile Crescent in the Near East and the Middle East, and then in Eastern Asia, and also in New Guinea, in Sub-Saharan Africa, and in several parts in the America and along the Mississippi. So we have independent emergence in several parts of the world in the last 10,000 years. And then from these different regions, there was a diffusion of this way of living, either through population expansion. This was the case for Europe when the Neolithic arrived through the expansion of Anatolian population. It's true also for Southern Africa or Southeastern Asia. But on the other hand, in some places, the Neolithic way of life diffuses just by cultural means without any population replacement. And that was the case in the Middle East, for example. So now almost all of the human population, in fact, a high number of human population have a Neolithized way of life, and the Neolithic revolution has won the battle. But what do we know about Neolithic revolution? We know that it's the domestication of plants and animals. And what is domestication? Well, there is several definitions, but one definition is that it is a relationships between two groups of organisms. These relationships last for a long time. It's a multi-generational relationship. And in this relationship, one group of organisms takes care of the other group in order to secure a very predictable supply of resources. And in fact, it supplies a very predictable, it secures a very predictable supply of resources by increasing the amount of meat and the amount of animals or plants that are domesticated. And here is a recent study that tried to estimate the global biomass for each taxa. So you can see here, for example, that the plants have a huge impact on the biomass in Earth, but the bacteria also has a huge impact, and the animals, well, not so important. And inside the animals, well, the insects, the arthropods have a very huge impact. But if you look for the mammals, well, the livestock is huge. The humans are very, very important too. But on the other hand, the wild mammals, not so important. This is another way to show that the mass of the cattle, of the livestock and humans is amazing compared to the wild animals. And this is not only true for the mammals, but also for the birds. If you can compare the mass of the wild birds versus the domesticated poultry, and you see that the domesticated poultry weight more than twice the mass of the wild birds. And they tried also to estimate the biomass of mammals before the Neolithic and now, and you can see that the Neolithic led to a huge increase in the biomass of mammals now, but a huge decrease of the biomass of the wild animals, of the wild species. And this is not really a victory for mammals in this case, because at the same time the biomass of mammals increases, there was a huge decrease in the species diversity. So, okay, we have a lot of kilograms of mammals, but they all belong to less than 10 different species. The other things which is interesting in domestication is not only the increase in the mass of animals and the mass of birds, but it's also that the group that take care of the other assume a significant degree of influence over the reproduction. It means that domesticated animals cannot reproduce freely, and that the humans are going to settle to open the reproduction only to a few selected animals. And that's how they select the animals that can reproduce. Well, the animals that can reproduce are the ones that are interesting for the humans. And so, for example, generation after generation, this selection led to the fact that the domesticated plants or the domesticated animals have characteristics that are beneficial for humans. Here, for example, you have the teosinte, which is the wild corn. And you see there's only a very small number of grains here compared to the modern corn, where the grains are bigger and the number of grains is much higher. The same is true also for the cattle. Here you have the decrease in size between the wild aurochs and the Iron Age, so 2,000 years old cattle. Why did they do that? Well, I think that it's more easy to manage small bovines than big, huge aurochs. So this artificial selection is made for human benefits, and it's not always beneficial for the animals themselves. And this, I won't go deep into the details, but this is linked with massive changes in the genes and genomes of their species. For example, for the wheat, the domestication is led to a multiplication by 3 of the quantity of DNA inside the wheat genome. So it's before the GMO, but it's already artisanally huge change in the genetic diversity of the domesticated species. And for the animals, we can see a lot of genes that have been selected, either for tameness and domestication issue, or for the colors. You can see here the gene MC1 hair, which is a very important gene in the skin and hair color in different animals. That's why we have now domesticated animals with a high variety of colors. And also there was a selection for some features that are beneficial for the humans. For example, the speed in horses, the amount in milk in cows, goats, and sheep, the amount of meat in pigs, or the number of eggs in the poultry. In the same time, there was an accumulation of deleterious variants, bad variants for the animals. That's why now, if you take some pig or some goat and you put it into the wild, it is not going to survive for a long time, because the alleles that helps to survive in the wild were not selected by humans, and so they disappeared through time. And what does that mean for us? Well, we have milk even when we were adults. For mammals, usually the milk is a baby food. It's only for the babies, and after the weaning, there is no more milk in the diet of any mammals. Thanks to domestication, humans were able to have milk, even to drink milk, even when they're adult after the weaning, but that caused a problem, because in the milk there is a sugar, the lactose, and we are not able to digest the lactose after the weanings. It's really a baby food. And so people were drinking milk but had a huge stomach problem due to the lactose that is not digestible. So what did they do? They did cheese. And this is an example of a pottery for cheese making that dates back to Neolithic and has been found in Poland. But the changes in the diet has also other impact and lead to other diseases. The first problem is a decrease in animal proteins that were the diet was of poor quality, and the increase in the starch content. And you can see that this kind of diet linked to cavities in the teeth, and so that can link to huge health problems. So even if the number of individuals during the Neolithic increases hugely, the health of this individual was very poor, and when they died, their bodies were used. Neolithic revolution is not only the domestication of plants and animals and the new diet for humans, it's also about sedentarization and landscape transformation. And this landscape transformation may have had already a huge impact on the global climate. Some scientists observe that there is a beginning of methane emissions as soon as the Neolithic, and they link that to the beginning of the rice culture. And in the rice fields, we know that they can provide a huge amount of methane. So that's still discussed in the community. But I think that's interesting that our impact on the global climate can be older than we thought. The sedentarization also has an impact for us, for our biology. So this is the first villages that happened first in Anatolia and in any region that was Neolithicized. And the first villages lead to several problems. The first problem is the waste management. What do we do with feces? When we live in small groups, when we move frequently, the feces are not really a problem. When you live in a village with hundreds or thousands of different families, feces and waste management can become a huge issue. Sometimes these wastes are used for fertilization, but in this case, if one individual has some parasites, it will infect other people through the food, infecting the gardens, the plants, and then the people that are eating the plants. So that can lead to huge impact of parasites. The other problem is just the high human density. When you have a lot of people together, it helps the propagation of diseases. And at the same time as the first village, the first commercial roads also began to develop and help the propagation of diseases. And interestingly, there has been some study in paleogenetic studies about the plague that showed that the first example of Yersinia pestis infecting humans were found at the same time as the first villages in Ukraine of the Tupilier culture. And interestingly, the plague began to diffuse after the horse domestication and the fact that it was easier to move from one village, one place to another. So we think that these villages and these commercial roads have a huge impact on the emergence and propagation of diseases. For the emergence, another problem you can see here is that the proximity with the cattle. When we were hunter-gatherers, we had proximity with animals, but those animals were dead. And so the transmission of pathogens from the animals to the human was not very frequent. After the Neolithic, human lives in close proximity with the domesticated animals, and so some diseases from the animals can go to the humans. And this has been found for the brucellosis. The brucellosis is a disease that can cause some fevers, algia, and even lead to neurological disorders, and that leave an impact on the skeleton, this kind of cavities you can see here on the bones. And brucellosis is transmitted through the ingestion of contaminated dairy, contaminated milk, and there was no brucellosis before the Neolithic. This is the disease that emerged with the Neolithic way of life. Other examples are the salmonellosis and all kinds of typhoid fever, which are due to a bacteria, Salmonella enterica. And there has been a paleogenetic study too that compared the strains present now in modern human and the strains present in early farmers and the strains present in other animals. And that showed that the Salmonella enterica that cause today the typhoid fever and the salmonellosis were linked to a zoonosis transmitted by the pigs to the first farmers, and then it go on through times until now. And another example is the tuberculosis, and the strain of tuberculosis that plagues the human today emerged some 2,000 to 60,000 years ago in Africa, and it's just the time of the Neolithic revolution in Africa. So it may have been transmitted from cattle to human during this Neolithic, at the beginning of the Neolithic in this area. So you see that we have a diet change that can lead to diseases. We have the proximity with cattle that can lead to zoonosis. And the commensal animals, I will not explain the role of rodents and especially of the rate in the propagation of the plague during the Black Plague in Europe. But all of this can lead to zoonosis and are linked to diseases. And the high human density favors also the propagation of diseases. So there has been a huge change in the microbial environment during the Neolithic. So what happened then? Well, selection occurred. The people that have genetic variants that can help to resist to this diseases increase through time from one generation to the other. And one example is a TYK2 gene here, which is linked to tuberculosis resistance. And we can see that the selective pressure on these variants began a few thousand years ago, so around the same time as the emergence of the major tuberculosis strain. There is other genes that are very frequent, other variants that are very frequent in Europe. We think that these variants were selected during the Black Plague, during the Middle Age in Europe. During this time, half of the population died of the plague, and that must have had a huge impact on on the genetic diversity of Europeans. There is other variants that are linked to the lactose digestion in adults, that the expression of lactase even during the adulthood. And interestingly, there is several events, independent events, but always in population that have cattle and drink milk. So for example, in Eastern Africa here, in Northern Europe, but also in Saudi Arabia, or in some population in Central and Western Africa. The same problem, having milk and not being able to digest it, linked to different selective pressure on the selection of different genetic variants here. And another problem is the amount of starch in the food. And the matter with starch is that there is not a lot of vitamins inside, especially for the ergothioneine, and people by population that eat a lot of starch and not a lot of other plants can have deficiency in this vitamin. And you see that, for example, in the Andean, there has been selection to help to adapt to this new kind of food. Also selection for the digestion of the starch in other population through the gene ME1. And so it seems that all is good again. We change our environment, but we were able to adapt to this new environment through time. But in the last 2 centuries, another huge change occurred. We can say that it is following the Neolithic revolution. It's just the Neolithic and at a new degree. We've not villages, but big cities. We've not horses to move, but trains and planes and very rapid way of moving. But the changes were again dramatic. So now people, half of the world population lives in high density cities. There is also a change in the food. There is less starvation. We do not need, except yet in a few population, but in the majority of the world population, we have a high caloric intake, not always of a very good quality and a lot of vitamins inside, but a high caloric intake. And so the genetic variants that help to adapt to starvation now are linked to a high BMI and cardiovascular problem, and other kind of a health problem linked to this high caloric food. There is also a better hygiene and antibiotics, which means very good. It means that we are not dying. Well, usually we're less and less dying of infectious diseases. But our immune system is adapted to having a lot of different microorganisms around. And these better hygiene, these antibiotics may be linked for some scientists to the development of allergy and autoimmune diseases. There is long-distance population and long-distance movement, either for population or for individuals. And we have seen in the last 2 years how it helps the propagation of diseases. And there is also pollution that have also a huge impact on our health. And at the same time of all this, there is also the ecological changes and different kind of ecological changes. For the climate change, that will have a huge impact, but still unknown, on the food production and the pathogen distribution. An example for us in France is the tiger mosquitoes that we didn't have before, and now it's quite frequent even in the Paris area. And these mosquitoes can propagate new diseases that were not known in this area in temperate regions. We also have a decrease in biodiversity, and it will surely have a huge impact on human biology, but still unknown and still to discover. And we are so numerous now, the human population is so huge that the contact with the wild species are more numerous, more frequent, and that can lead to the emergence of new diseases. So some of the changes are indeed positive, and we can see now that we have a huge population growth. We are less and less dying of infectious diseases and more of cardiovascular problems and other old age problems. But we do not know yet the impact of the climate changes and the biodiversity crisis for humans. And we have seen very recently how just a simple virus, just a few number of genes, can disrupt our societies. And the other thing I want to say here is that, okay, humanity has already known changes, environmental changes. But here, the environmental changes is huge. The scale of the changes is huge. When we left Africa, when ancestors of non-African population left Africa, it was only a small population, and the rest of humanity remained in the same environment, or more or less the same environment. When some humans began to have a Neolithic way of life, at the same time, we were still hunter-gatherers, but go on with a hunter-gatherer way of life for thousands of years. Now it's global. All the earth is changing at the same time. We do not have any refugia like we can have before. And the other things I think that is very important is the speed. For biological adaptation, you need to have some time. Now the speed is so fast in a few generations, but we know that any biological adaptation will not going to. So we have to put our to adapt through technological and through change in our way of living. Thank you. This is a few of the articles, scientific articles that I used for the figures and the numbers in this presentation. And I also used a lot of discussion with my colleagues from the museum and from the Musée de l'Homme, and colleagues from the Pasteur Institute, and of course a lot of archaeologists and anthropologists that helped me. And thank you for your attention, and I hope we can have a degree of discussion. Thank you.
Thank you so much, Dr. Bon, for that really interesting talk. I think we have time for one or two audience questions. The first question that our audience really wanted you to briefly speak a little bit more about, I know you were speaking about it as your talk ended. What can we learn from our past influence on our environment, and how can we apply these lessons when we interact with our environment today? What can we learn from our past story?
It's a huge question, and there's been a lot of different way of dealing with the change, environmental changes in the past and in different human societies. I think that rapid changes in the past have led to disruption of the societies. For example, I'm working on populations and civilization in the Iran and Tajikistan, Uzbekistan area. And this area is quite complicated because it's a desert. For a long time, people were having irrigation, using wisely the water from the mountains to irrigate the fields. And at the time, the population became too big. And at this time, the irrigation was not sufficient enough. And then the civilization collapsed. So it was just a collapse of this part of the world, and the other part of the world were not touched by this problem. But I think that we have seen already that former or other civilization can collapse if the environment changes. It's too huge if we cannot have enough food for everybody, and if the changes is too fast. So I think that it's not impossible that the changes in our civilization could be huge.
Absolutely. And then the second question that I have is about our biodiversity in our environmental systems and our ecosystems, and what is their ability to survive the threats of climate change? What role does genetic change or phenotype plasticity play? What's really the ability of those flora and fauna to adapt?
For us humans?
For mammals and plants in the broader environment?
So I think that for animals, the climate change is not such a problem because animals can move. So if the weather in one area is too hot, they can go northern part of the world, and then we can imagine, and we see already for some insects, for example, that they are moving northern. The problem of the climate change is especially for trees that cannot move and that a very long generation time. And we see, for example, in the Alps that a lot of trees are dying now of the climate change. And they are not able to move and they are not able to adapt because their generation time is too long. So when the trees are dead, now the problem will be very important for the animals because they cannot eat anything. So the problem is not a first generation problem for the animals, it's more a second generation problem. So I think that through time, there will be adaptation of the plants too. So some plants that have genetic variants that help to adapt to the new climate will have more children and will use the soil and the environment. And some plants are going to move northerner, but it may take a long time. And I don't know how we mammals, how we animals are going to deal with this time of adaptation. That's the problem of the speed of the climate change.
One follow-up question our audience had about that, and you talked a little bit about this with the Neolithic Revolution and tool use and changes in how humans were doing things. How much is technology now changing pressures that we're facing due to environmental changes?
That's a very good question. I don't have the answer, and I think that time will show us if we are able, through our brains, through our technology, to invent a new way of dealing with this huge transformation. I guess that we will be able, for a number of things, to deal with that. For example, to select plants that are more resistant to drought or to the heat, for example, for our diet, and so on and so on. So I think we will be able to deal in a part using our technology, using our brains with this climate change. The matter is we also need time to develop the technology.
So I guess we have time for one more question, and I think that question would be, can you give us a few key takeaways, things that we can take home from your message today and carry forth after this symposium?
Okay, maybe the take-home message is that we have known a lot of changes through the human history, and the life has known a lot of changes through human history. So we're not going to disappear, but one can be problematic is that we may not going to go on having the same way of living, and we may have huge changes in our ways of living.
Well, thank you so much for joining us today. This was a really
You're very
great talk.
welcome.
Absolutely. And thank you all for this amazing second day at our symposium. Thanks to our incredible speakers, our audience, and don't forget to join us again tomorrow morning for the last day of the symposium, starting at 9 a.m. Eastern Daylight Time. We'll be discussing oceans. We'll discuss topics ranging from equitable coastal resilience to marine archaeological heritage. And you can join the symposium tomorrow with the same link that you used today. So thank you all for your time, and I look forward to seeing you all tomorrow morning.